After 60, the most dangerous health problems are not the ones that make you feel pain. They're the ones that don't show any symptoms at all until it's too late. Heart disease, colon cancer, kidney failure, even certain types of diabetes, these are often called silent killers for a reason. They quietly damage your body for years, sometimes decades, without a single obvious sign. And by the time symptoms appear, the damage is already done. That's why many seniors say, "I felt fine," until the day everything changed. But here's the good news. Modern medicine gives us a way to see these threats before they strike. Through regular health screenings and simple blood tests, you can catch early warning signs, take action, and even reverse the course of disease. In today's video, we'll show you the 9 most important tests that doctors recommend for people over 60, especially if you want to stay independent, active, and healthy in your 70s, 80s, and beyond. These aren't fancy, expensive procedures. Most of them take less than 30 minutes, and they could literally save your life. If you find this topic helpful, please consider liking this video and subscribing to the channel. It's a small click for you, but it helps us continue creating content that protects and empowers people just like you. Now, let's take a look at the tests that could change everything. Among all the health checks you can do after 60, blood work and blood pressure monitoring remain 2 of the most vital, but also the most underestimated. Once you pass 60, your body doesn't always speak loudly. The most dangerous changes often happen quietly, inside your bloodstream and arteries, long before you ever feel a single symptom. That's why regular blood work is considered one of the most essential tools in preventive healthcare for seniors. Health expert Dr. Jennifer Schrack explains that routine blood tests act like a window into the body. They allow your doctor to monitor key markers that signal potential health problems, such as blood sugar levels for diabetes, kidney function via creatinine and BUN levels, liver enzymes, cholesterol ratios, and even inflammation levels that can hint at heart disease or cancer risk. These early markers are invisible to you, but they give your doctor a powerful map to track changes over time and take action before things go wrong. In the United Kingdom, adults aged 40 to 74 who don't already have a diagnosed chronic condition are invited to participate in the NHS Health Check. This free, government-supported screening includes a full cholesterol test, blood pressure measurement, and an overall risk score for developing heart disease, stroke, type 2 diabetes, or even dementia. It's quick, painless, and saves lives. In the United States Preventive Services Task Force, USPSTF, strongly recommends that adults aged 65 and older get their blood pressure checked at least once a year, even if they feel perfectly fine. Why? Because high blood pressure is called the silent killer for a reason. It often causes no pain, no fatigue, no discomfort, until it leads to a heart attack, stroke, or kidney failure. And that's not the only hidden danger. The National Heart, Lung, and Blood Institute urges seniors to get their cholesterol levels tested annually as well. Bad cholesterol, LDL, builds up slowly, sticking to artery walls and restricting blood flow, setting the stage for major cardiovascular events without any outward signs. Bottom line, just because you feel okay doesn't mean you are okay. These numbers, your blood pressure, cholesterol, and lab results, can tell a different story. They are early warnings, and the good news is they're easy to check. A quick visit to your doctor or health clinic for these simple, non-invasive tests could mean the difference between catching a problem early or dealing with a crisis too late. Beyond blood pressure and blood tests, there's another silent threat that often grows undetected for years: colorectal cancer. While blood tests and blood pressure readings help us detect internal imbalances early, there's another silent threat that requires a different kind of screening: colorectal cancer, also known as bowel cancer. Unlike many illnesses that show clear symptoms in their early stages, colorectal cancer often develops slowly and quietly. By the time noticeable signs like bleeding, fatigue, or weight loss appear, the disease may already be advanced. That's why regular screening isn't just recommended, it's life-saving. In the United States, The U.S. Preventive Services Task Force, USPSTF, recommends that adults aged 45 to 75 undergo routine screening for colorectal cancer, even if they feel completely healthy. This may include at-home stool tests, sigmoidoscopies, or colonoscopies, depending on personal risk factors and your doctor's guidance. In the United Kingdom, a similar national program exists. Adults aged 60 to 74 receive an invitation every 2 years from the NHS for a free bowel cancer screening. This often involves a simple fecal immunochemical test, FIT, that can be done at home. The sample is then sent to a lab where experts check for hidden traces of blood, often one of the earliest signs of cancer in the colon. The beauty of these screenings is their simplicity and power. Catching polyps or cancer cells early allows doctors to remove them before they become life-threatening. In fact, when detected early, colorectal cancer is one of the most treatable types of cancer. So if you're over 60 and haven't had a recent bowel screening, don't wait. It's not just another test. It's a critical step in protecting your long-term health and independence. You may feel healthy, but deep inside, rising blood sugar could be quietly damaging your heart, eyes, and kidneys. This is the hidden danger of type 2 diabetes. Just like colorectal cancer, type 2 diabetes is another condition that can quietly damage the body for years before any outward symptoms appear. And by the time you notice something is wrong, like fatigue, frequent urination, or blurred vision, your blood vessels, nerves, and organs may already be affected. That's why early detection is critical. The U.S. Preventive Services Task Force, USPSTF, advises adults between the ages of 35 and 70, especially those who are overweight or physically inactive, to undergo screening for prediabetes and type 2 diabetes every 3 years. But for those over 60, this recommendation becomes even more important. Aging increases insulin resistance, slows metabolism, and raises the overall risk of developing diabetes, even in people with no prior symptoms. In the UK, seniors aged 65 and older who are diagnosed with type 1 or type 2 diabetes are eligible for diabetic eye screening through the NHS. This crucial test helps detect diabetic retinopathy, a common complication that can lead to permanent vision loss if left untreated. The screening is painless, quick, and can catch tiny changes in the blood vessels of the retina, often before the patient notices any change in sight. The danger of type 2 diabetes isn't just high blood sugar. It's the slow, widespread damage it causes throughout the body, impacting the heart, kidneys, eyes, and even the brain. But the good news is, caught early, diabetes is highly manageable through lifestyle changes, medication, and ongoing monitoring. So if you haven't been screened for diabetes in the last few years, talk to your doctor. One simple blood test could help you take back control before diabetes takes hold silently. Just because you've passed 60 doesn't mean you're past the risk. Breast and cervical cancers still require your attention. When women pass the age of 60, they often stop thinking about certain health risks that were once routine in their 40s and 50s. But the truth is, 2 of the most serious cancers affecting women, breast cancer and cervical cancer, don't simply disappear with age. In fact, the risk in some cases increases. Let's start with breast cancer. According to the American Cancer Society, women aged 55 to 75 should have a mammogram every 1 to 2 years. This quick, non-invasive breast X-ray can detect tumors that are too small to feel with the hand, often long before symptoms appear. At this stage, treatment is much more effective, less invasive, and survival rates are dramatically higher. Why does the risk continue after menopause? Because hormonal changes, family history, and even lifestyle factors like weight gain or alcohol use can all increase a woman's risk for breast cancer in her 60s and 70s. Unfortunately, many women skip mammograms simply because they feel healthy or haven't had issues in the past. But cancer doesn't wait for symptoms. In the UK, women aged 50 to 70 are invited every 3 years for free breast screening under the NHS breast screening program. a service credited with reducing mortality significantly through early detection. Now let's talk about cervical cancer. It's often associated with younger women, but that's misleading. The virus responsible, HPV, can live in the body for years without symptoms, and cervical cells may become abnormal or cancerous well into your 60s. That's why the American Cancer Society recommends women continue cervical cancer screening until age 65, either through a pap smear every 3 years or an HPV test every 5 to 6 years, both of which look for changes in cervical cells before they become dangerous. In England, the NHS offers cervical screening every 5 years to women between 50 and 64, a program designed to catch early-stage changes long before cancer develops. After age 65, women who've had regular normal screenings may be able to stop, but only if advised by their doctor. Here's the most important takeaway. These 2 screenings aren't just routine, they're protective. They give women the power to detect hidden threats before they grow. And in most cases, the earlier the detection, the simpler and more successful the treatment. So if you're a woman over 60 and you haven't had a mammogram or cervical screening in years, now is the time. It's not about fear, it's about taking control. One appointment could protect your future, your independence, and your peace of mind. Amid all the screenings women over 60 are advised to get, one crucial test is often forgotten, until it's too late: the bone density scan. After 60, a woman's body undergoes countless changes, some visible, many invisible. And while cancer screenings are often prioritized, there's another silent issue that deserves just as much attention: bone loss. As women age, especially after menopause, estrogen levels drop sharply, a change that directly affects bone density. Bones begin to lose their strength, becoming thinner, more brittle, and much more prone to fractures. What's most concerning is that this process happens slowly and without pain, until one day, a simple fall leads to a broken hip, spine compression, or even long-term disability. That's why the U.S. Preventive Services Task Force, USPSTF, strongly recommends that women aged 65 and older undergo a bone density scan, also known as a DEXA scan. This non-invasive test measures the strength and thickness of your bones, particularly in the hips and spine, allowing doctors to detect osteopenia, mild bone loss, or osteoporosis before it leads to a life-altering fracture. The consequences of weak bones can be devastating. According to studies, nearly 1 in 3 women over 65 will suffer a bone fracture due to osteoporosis. And unlike other injuries, recovery from hip or spinal fractures in older adults is long, painful, and often incomplete, leading to loss of independence and mobility. But here's the hopeful part. Osteoporosis is preventable and treatable, especially when caught early. With proper nutrition, weight-bearing exercise, vitamin D and calcium supplements, and in some cases medication, bone loss can be slowed or even reversed. So if you're a woman over 65 and have never had a bone density test, or it's been several years, it's time. Don't wait for a fall to discover that your bones have been weakening silently for years. Protect your foundation, because strong bones mean more than just fewer fractures. They mean freedom, stability, and the ability to keep living life on your own terms. For older men, especially those who have ever smoked, certain health screenings aren't just recommended, they're potentially life-saving. While many health screenings after 60 are essential for both men and women, there are certain tests that men, especially those who have smoked, must take seriously. Because some of the most dangerous conditions in older men grow silently and strike without warning. One of these is the abdominal aortic aneurysm, AAA, a bulge or weakening in the wall of the main artery running through your abdomen. If it ruptures, it can cause internal bleeding and death within minutes. It rarely causes symptoms beforehand, which makes early detection absolutely critical. That's why the U.S. Office of Disease Prevention and Health Promotion recommends that men over 65 who have a history of smoking, even if they quit years ago, speak with their doctor about getting screened for AAA. The screening is a simple, painless ultrasound that can detect dangerous changes in the aorta before they become life-threatening. In the UK, this risk is recognized just as seriously. Through the NHS Abdominal Aortic Aneurysm Screening Program, all men are automatically invited for a one-time ultrasound scan when they turn 65. It's a quick test, but one that can prevent a sudden, catastrophic emergency. In addition, former smokers, especially those over 60, should receive annual lung cancer screenings. Long-term exposure to tobacco, even in the past, significantly raises the risk of lung cancer, which often develops without noticeable symptoms until it's in a later stage. A low-dose CT scan is now widely recommended for high-risk individuals in the US. It can detect tiny nodules or signs of cancer early, offering a much better chance of successful treatment. If you're a man over 60 and have ever smoked, even if it was decades ago, don't brush this off. These targeted screenings are not about guilt or fear. They're about protecting your future with the knowledge and tools available today. As men enter their 50s and beyond, prostate health becomes an increasingly important concern, especially when it comes to the early detection of prostate cancer, one of the most common cancers among older men. Screening for prostate cancer typically includes two main methods: a digital rectal examination, DRE, where a doctor checks the prostate for lumps or irregularities, and a prostate-specific antigen, PSA, blood test. PSA is a protein produced by cells of the prostate gland. When levels of PSA are elevated, it may indicate the presence of prostate cancer. However, it's important to understand that high PSA levels don't always mean cancer is present. Benign prostatic hyperplasia, enlarged prostate, infections, or even recent physical activity can cause temporary spikes. Because of these uncertainties, the U.S. Preventive Services Task Force, USPSTF, advises men between the ages of 55 and 69 to have an informed discussion with their doctor before undergoing PSA screening. This conversation should cover both the potential benefits, such as catching cancer early while it's still treatable, and the possible harms, including false positive results and unnecessary biopsies or treatments that carry their own risks. Fortunately, Medicare in the U.S. covers an annual PSA test for eligible men over 50. In England, men aged 50 or older are also eligible to request a PSA blood test through the NHS, though it's recommended they discuss it first with their general practitioner to understand what the results may or may not mean. Ultimately, prostate screening is not a one-size-fits-all approach. It's a personal decision that should be made with full understanding and professional guidance, because sometimes peace of mind comes not from doing more, but from making the right choice at the right time. After addressing prostate health, it's equally important to turn our attention to something we often take for granted: our vision. As we grow older, especially past the age of 65, changes in eyesight become more common, and routine eye exams can mean the difference between early treatment and permanent loss of vision. According to the American Academy of Ophthalmology, everyone aged 65 and older should schedule a comprehensive eye exam once a year. During these checkups, ophthalmologists look for a range of age-related eye conditions, including cataracts, macular degeneration, and the early signs of glaucoma. These conditions often develop slowly and without pain, which makes regular screening the only way to detect them before they cause irreversible damage. If you're already experiencing blurry vision, trouble seeing at night, or sensitivity to light, more frequent eye exams may be necessary. One condition in particular, glaucoma, can steal vision so gradually that many seniors don't realize it until the damage is done. That's why frequent screenings are considered the gold standard for early intervention. In the United Kingdom, the NHS offers free eye exams under specific circumstances. If you have diabetes, if you're over 40 with an immediate family member diagnosed with glaucoma, or if you've been referred by an eye specialist, you qualify for cost-free screening. These policies are designed to make sure high-risk individuals get checked before it's too late. Keeping your vision sharp isn't just about seeing clearly. It's about preserving your independence, your ability to read, drive, recognize faces, and fully enjoy life. A simple annual exam could be your safeguard against a future of silent decline. Once vision is checked, there's still one more area that many people overlook, but it may be the most telling of all: your overall physical and cognitive resilience. After the age of 65, doctors are increasingly paying attention to what they call geriatric syndromes, a group of subtle but powerful signs that often reflect deeper declines in health. These syndromes include frailty, reduced strength and endurance, sarcopenia, age-related muscle loss, unintentional weight loss, and early symptoms of cognitive decline or dementia. While none of these conditions are diseases on their own, they act like warning lights on the dashboard, telling us that the body or mind may be struggling to keep up with the demands of aging. Dr. Sanford and her colleagues recommend that people over 65 be routinely screened, even briefly, for these issues during regular checkups. These screenings aren't complicated. Sometimes it's as simple as noticing a slower walking speed, a weaker grip, or difficulty remembering names and tasks. But when caught early, these signs can prompt targeted interventions, such as strength training, dietary changes, or memory exercises that help maintain function and prevent more serious outcomes like falls, hospitalizations, or complete loss of independence. As Dr. Sanford puts it, it's all about establishing where you're at right now, so that in 5 years, if you come in with a concern, we can clearly see what's changed. In other words, screening for geriatric syndromes isn't about labeling people. It's about tracking your baseline so that your health doesn't quietly slip away without anyone noticing. And the sooner we notice, the better we can help you stay strong, sharp, and self-reliant. No one likes going to the doctor. No one enjoys tests, scans, or reminders that time is moving forward. But if there's one truth we've learned today, it's this: after 60, silence is not safety. The most dangerous conditions, cancer, heart disease, diabetes, dementia, often begin with no symptoms at all, yet the power is still in your hands. These screenings we've explored aren't just medical procedures. They are acts of self-care, of protection, of choosing life and independence, one simple checkup at a time. So if you haven't had one of these tests recently, maybe now is the moment. Not out of fear, but out of love, for yourself and for those who still count on you. If this video helped you see something differently or reminded you to take that next health step, please consider liking this video and subscribing to our channel. We create thoughtful, age-positive content to support you every step of the way. And before you go, we'd love to know, where are you watching from today? Let us know in the comments. You're part of a global community of strong, wise, and inspiring people after 60, and your story matters here. Stay well, and we'll see you in the next video.